let's talk about supporting moms as a doula and helping them reduce their risk for tears specifically. I have been a doula for 15 years and I've done a few trainings. And the trainings didn't really cover much about how I, as a doula, can really support. It's kind of more like, hopefully they don't tear. I feel like the attitude that I've observed in doula trainings, I'm sure everyone is different, but as a doula, just in my own experience, that's what I've observed. We want to independently educate ourselves as doulas and as mothers so that we have a plan in place to help us reduce the risk for tearing. That's so much more comprehensive than what the typical approach is, which is kind of like, hope for the best, do your breathing techniques, let the doctor be hands-on, right? Not that there's anything wrong with those things, but I do know that there's so much more that we can incorporate into supporting a mom and reducing the risk for tearing during birth. I created a 4-step process to reduce tear risk that I reserve for my private coaching clients and the doulas in my mentorship program. And I'm going to introduce that for the first time ever, actually, and free content. I could speak on this 4-step process for hours. The moms in my coaching program, we spend many, many hours going through this and making it really personalized to them. So this is just going to be an introduction on the 4 steps. I'm going to cover some of my favorite points for every single one of those steps. So the way it was created was I tore with my first, and I felt the pressure of my baby's head coming out. Babies go through this normal 2 steps forward, 1 step back, 2 steps forward, 1 step back, often kind of process, so that pressure builds. And this is your body's way of protecting your perineum. So the body already knows how to protect you from getting severe tears or to protect you from tearing at all. And I was feeling this process happening and I was feeling the pressure build. And I had been a doula for 9 years. So at that time, I knew a lot of stuff. I had a doula and I had a midwife and I was in the water. I was doing all the right things and I still got a 2nd-degree tear because I felt the pressure of her head coming down. And as soon as she went to crown, I was like, get this baby out. I added extra force. I just engaged my tummy muscles and went, and like got her out too quickly. And that is why I tore. So I went on to work at a busy birth center for many years. And when I was there, I just noticed that hardly anyone ever tore. I was a student midwife at the time. And there was this running joke that I would never get to learn how to repair a tear because hardly anyone ever tore. And they were like, Victoria, you're never going to get to be a midwife because you never get to practice, doing the sutures. It's hilarious. So I repaired 3 tears in the 2 years that I was there. Every once in a while, moms would get a 1st-degree tear, which is a small tear that goes into the skin. Doesn't require stitches usually, but someone really needing stitches was very, very rare. What I learned with these midwives was an approach to pushing, which means how we're pushing, how we're going into pushing, that really honors physiology and protects the perineum from tearing. And so after that, I got pregnant with my 2nd and I was like, okay, so how am I going to not tear this time? I really don't want to tear. I know an approach to pushing that honors physiology. I know what the evidence has to say. Like you could Google how to reduce tear risk and it'll say the warm compress, the right position, yada, yada. I know what all that stuff is. Still, there's a problem, which is that last time I freaked out and I forgot I was supposed to go slow. So how can I feel safe and remember to go slow, right? So I just figured it out with my husband throughout my pregnancy. We created tools. I realized then that when you're in labor, in that moment, your thinking brain turns off. We forget a lot of the stuff that we know. Like I can tell you right now, if you're a mom watching this, remember to go slow when your baby's coming down. I can tell you as a doula, if you're watching this, tell your client when the baby starts to come down, go slow, slow, deep breaths. It does not matter if the person in that moment who's giving birth doesn't have the nervous system capacity, doesn't have the safety to allow their body to relax and slow that process down. So I just worked on building positive associations to the feeling of pressure, teaching my pelvic floor to respond to pressure with relaxation, and building relationships with my fears. Not like my fear, I'm just getting over it and there's no more fear anymore. More like I'm driving a car and my fear is a passenger in the car. And I can say, hey, fear, you're here in the passenger seat, but you're not taking the steering wheel and driving my experience, right? So it's about building the self-awareness and relationship. So I felt the pressure of my baby's head come down and I went to crown and I was like, he's crowning. I was so calm and relaxed. I felt no pain. I felt no burning. I felt no ring of fire. It was just pressure. And pressure in the absence of fear is just pressure. I felt neutral, leaning towards pleasure, actually. It was a very, very cool experience. And with my third, I did the same thing. I used the same tools and I didn't tear. I didn't have burning. I didn't have the ring of fire. It was just pressure. And it was a beautiful experience. So from all of those experiences in my trainings, I created this 4-step process to support parents in reducing the risk for tearing. And I first want to say that, as a doula, we shouldn't ever promise a mom, like, for sure, if you do this, you will not tear, right? I think it's good to kind of talk about tearing like, it's normal. It's something that can happen sometimes during birth. And there are ways to reduce the risk. So let's create a plan that feels really good and supportive for you. So when you think about the actual delivery of your baby coming out, you feel empowered, you feel confident, you feel like you have tools, not like we're just gonna hope for the best, right? Which is how a lot of people approach the pushing stage, and we don't want that for you. We want everyone to go in feeling really confident and prepared. And so as a doula, this is something that you can facilitate. So let's take you through the 4-step process. Number 1 is learning an approach to pushing that honors physiology and reduces tear risk. So it's important as a doula to talk to your clients about, their birth education, how they want pushing to go, if they've learned about the difference between directed pushing and spontaneous pushing. A doula does not replace comprehensive birth education. They can fill gaps and they can provide a lot of education for sure, but they don't replace a comprehensive birth class or birth coaching. I think it's important to support our clients in creating that plan, and also at the same time encouraging them to take responsibility for their own education and take a birth class. You can even explore local resources with them or online resources with them and make some referrals perhaps if you notice that they really have no idea, about this, because it's really important that we understand so that we can make a choice that feels best to us. There are lots of different ways to go into pushing. You could go into pushing by waiting for the fetal ejection reflex, which is where the body spontaneously ejects the baby from the body, and the Ferguson reflex, which is where the baby's head comes down and puts pressure on a pressure point on the back of the vaginal wall. That stimulates the release of more oxytocin, which causes the uterus to contract closer together, and you get this overwhelming urge to push, and the body spontaneously pushes. The difference between experiencing the fetal ejection reflex and the Ferguson reflex and being ready to push versus feeling pressure but not being ready to push is that it's voluntary. So as a mom, if a mom were to feel pressure and say, does this mean I'm ready to push? I feel pressure? Probably not, if you cannot push. But if your body's spontaneously pushing, you're probably ready to push. And so this is a really great thing to understand going into pushing, so that it's something that if you want to experience that, you can give yourself the opportunity to do that by advocating for it, by perhaps laboring down if someone confirms you're 10 centimeters dilated and you say, well, I'm not really feeling the urge to push yet. In an unmedicated birth, we can wait a little bit, see if we get the urge to push. A recent study came out saying that laboring down was associated with really low rates of tearing, which is very cool. And this is also something that you can do with an epidural. With an epidural, moms often don't get the reflex to push. So directed pushing is much more common with an epidural, but that doesn't mean that someone has to do the traditional directed pushing immediately when they're on their back with their legs as far as they can and pushing to the count of 10. So let's kind of talk a little bit about what directed pushing is in comparison with spontaneous pushing and gentle guidance. Directed pushing is when someone is often told to be in a certain position, though sometimes that instruction isn't part of it, but it's pretty common that moms are told to get on their back, and someone will hold their legs back as far as they'll go, and then they'll tell you to hold your breath and push to the count of 10 as hard as you can, right? And we start doing this immediately upon 10 centimeters dilated. So what we found with directed pushing is that it increases the risk for tearing and it increases the risk for exhaustion, because you might start actively pushing, which means you're going right as hard as you can, maybe before the baby is very low in the pelvis, so the baby might still be a little bit high, and we don't really care about that. We're just looking to see if the cervix is open enough. But there's a difference between the cervix being open enough and the baby being down low, and the cervix being open enough and the baby being up high. So there's something called station. This is a great way to support your client in being able to make a choice that feels really best for them. So making an individualized choice when it comes to laboring down or waiting for baby to get lower or for the urge to push, compared to just going to directed pushing immediately upon 10 centimeters dilation. Babies can float above the pelvis at -3 station. They can engage deep into the pelvis where the top of the head meets the ischial spine at 0 station. and then babies will turn and they'll start moving down. And then once they're at crown, they're about at +3 station. So if a baby is at -1 station and you're 10 centimeters dilated, that might be a little high up in the pelvis to start pushing. If the baby is at 0 station or +1, where they're much, much further down into the pelvis, that might mean it's a good time to start pushing. So that is a really great question that as a doula, you can encourage the mom to ask, or you could ask yourself. If someone checks the mom, epidural or not, and says you're 10 centimeters dilated, time to start pushing, and you know that mom wanted to do spontaneous pushing or maybe wants to labor down, you could say, well, what is the baby station? That might give the mom some more information to make an informed choice. Because if the baby's -1, maybe it's a good idea to prevent exhaustion by offering the mom an opportunity to get in some different positions and to rest a little bit and let the uterus bring the baby down a little bit lower. It is not our job as a doula to ever make choices for moms, but it is our job to support informed consent being intact. And we're going to talk about that a little bit later when we get to step 4. So going back to step 1, this approach to pushing, it's important that moms understand what all these options are and that you are really clear on your knowledge of what they want for their birth so that you can support them in helping those preferences be intact. I highly recommend looking over their birth plan or making their birth plan with them or coming to my live birth plan building workshops that I hold. That's a good place to build a birth plan. And I have a free birth plan template in the Peaceful Birth Essentials course that any doula can use and share with their clients. So under the pushing section, it's important to use language that makes it really clear around what the mom wants. So saying things like, I will birth in whatever position I choose. Do not consent to directed pushing. I choose spontaneous pushing. Do not coach me to push. Things like that if the mom is choosing to take that path. If the mom wants to do something different, that's okay. But it's important that we're really clear on what that is beforehand so that you can support the mom in honoring that choice. If someone chooses gentle guidance, that is sort of like an alternative to directed pushing where someone might want a little bit of guidance. Maybe they have an epidural and they need some guidance because they're not getting the reflexes. Maybe their baby is having a little bit of a positioning challenge. So they're 10 centimeters, baby's nice and low, but we're just not really getting the stimulation on that pressure point. So we're not really getting that urge to push because of a positioning issue. If that were the case, directed pushing sometimes can be indicated, or we could try gentle guidance. Gentle guidance is less about, I'm going to tell you what to do and give you instruction, and more about offering some guidance to help the mom push. And this is something a doula can do or a healthcare provider can do. First, I would encourage the mom to get in whatever position feels most comfortable for them. Do you want to try this position? Do you want to try that? Listen to your body, what feels best. Once we're in that position, then we can focus on, okay, on the next contraction, we're going to take a big deep breath in and just engage your tummy muscles and push with your tummy muscles. Contract your tummy muscles down. That's a great way to push. A lot of people think that we need to push with our pelvic floor. We don't. The pelvic floor relaxes and softens and separates. So it's mom's job during pushing to relax, and your job as a doula to support the mom in relaxing during pushing and in between contractions. So often what happens is during pushing, mom is like pushing as hard as she can, and then she kind of gets into this like muscles tight, like tense sort of place. Remember that pushing is about relaxation. We can take our hands on the leg and jiggle in between contractions to support relaxation. We could actually do the spinning babies jiggle where we take our hands on the booty and thighs and do a little bit of jiggle. We can invite the mom to do a cleansing breath after the contraction. So after she pushes, we go, okay, big cleansing breath in and out, right, to like let it all go. Gentle downward strokes down the back. These are all great ways we can support a mom in relaxing. Sometimes moms don't want to be touched. They don't want to be, guided. They just kind of want to be left alone. Other times moms need a lot of guidance and a lot of holding hands and a lot of physical support. So it's our job as a doula to just be present in the moment, knowing that sometimes we're needed, sometimes we're not. We have to kind of shift things sometimes depending on what the mom needs. But offering gentle guidance often looks like guiding someone through verbalizing how to push by telling them to take a deep breath and contract their tummy muscles. Maybe they do that for a little bit. You don't have to count. Once they release the breath, you could say, okay, that's great. Do you want to try one more? See if they could do one more during a contraction, and just offer an opportunity for position changes and any kind of physical support with relaxation as needed. So I think that's a good summary of step 1, an approach to pushing. The next step is step 2, the evidence-based tools to reduce tear risk. So we want to incorporate evidence-based tools to reduce tear risk. And as a doula, I find that it's my responsibility to offer counsel to moms and some education to just see where I can fill in gaps, because sometimes moms will come to me and they'll say, okay, like I learned that perineal massage is really great for reducing tear risk, and I'm just so afraid of tearing. I don't want anyone's hands on my vagina. Like I don't really want to be directed a lot, but like I'll do it because I know that it's going to help me avoid tearing, right? And then that's an opportunity for me to say, actually, well, that thing that you learned online that says that perineal massage during pushing reduces tear risk, evidence-based birth has found that when we do perineal massage during pushing, it doesn't actually have an impact on reducing tear risk because the quality of research we have is so poor. So it's not evidence-based. And I'm hearing you say that you're kind of overwhelmed and stressed out about the idea of having someone putting their fingers in your vagina during pushing. That's understandable. So truly, like the best way for you to reduce your risk for tearing is by being relaxed and feeling safe. So we don't want to incorporate a tool that is evidence-based or not, that we think is supposed to be helpful, if it would make you feel uncomfortable. So it's really important that we do what makes you feel comfortable first. And if you feel comfortable with these different tools, then let's use them. But if not, then we're going to scrap it because your comfort is more important than some tool, right? So with perineal massage during pushing, we do have research on populations where they have an 80% episiotomy rate. And so with those people, we found that if we do have doctors like doing the massage, they have something else to do with their hands, so they're not cutting people. And then they have a lower rate of severe tears because episiotomy is associated with a 22-time increase in the likelihood for tearing. So that makes sense. But that doesn't apply to a population in the US where the episiotomy rate is around 15% or so, which is still very high. The evidence-based rate is 1%, but it's not 80%. So we don't have any good quality research that shows that perineal massage during pushing reduces the risk for tearing. Perineal massage in pregnancy as a first-time mom is an evidence-based way to reduce the risk for tearing. And I recommend doing it the Victoria way. I offer more personalized guidance in my coaching program, but I'll give you kind of a quick summary. The Victoria way to do perineal massage is to support a mom in feeling safe in the presence of pressure and to build positive associations to the feeling of pressure. So what we can do is you could do this by yourself. You can stand up in the shower and put your leg like on the bathtub and reach down with a thumb or a tool. You could also lie in your bed with a pillow kind of under one hip so you're not flat on your back and have a partner do it. Or a partner could do it in the shower with you too. The purpose is to insert a finger, which is very opening of the vagina. You don't have to go very far in, and just apply a little bit of pressure this way and a little bit of massage. A little bit of pressure this way and a little bit of massage from like 3 to 6 o'clock down. We don't have to do anything up here, but 3 to 6 o'clock down. I don't want anyone to approach perineal massage like it has to be uncomfortable. We're like really stretching the vagina. The goal is not to get your vagina to stretch whole, like a very wide open. It's just to allow yourself an opportunity to explore how stretchy your vagina is. This is more effective if you're in the physiology of sexy time because birth releases the same hormones as orgasm. So they both require the same hormones to function. It's really, really interesting. So if it's like a normal Tuesday night and you're like, I'm just going to put something in my vagina and see if I can stretch it wide open, of course that doesn't feel good. We want to make it sexy. We want to like add a little bit of pleasure. I mean, like you don't have to, but I think it's a really beautiful opportunity to build a relationship with that part of your body that is positive and pleasurable, where your joy and your pleasure is at the center and is being prioritized during this experience. You're not pushing yourself through something uncomfortable to endure something uncomfortable later. You're exploring how stretchy and how open your vagina can go and how easily that can happen with time and patience and safety and maybe a little splash of sexy. You could use a vibrator, you could do whatever you want to do. You also don't have to make it pleasurable, but I recommend using a lubricant like olive oil either way and taking your time and approaching it from curiosity. We're just going to explore this pressure rather than trying to like push yourself to like really, really stretch. So if you're a doula, I recommend talking to the parents that you're working with about perineal massage as a tool for emotional preparation. It's not evidence-based. You can tell them it's not evidence-based, but this lady online, that's really cool. I totally believe what she has to say. You should try it. This is one of the best tools you can use personally, in my opinion, to help you prepare for pushing because it offers you an opportunity to build relationships. As you're feeling the pressure, Focus on either feeling your birth intention in your body, the feeling of joy or relaxation, whatever it is. Focus on visualizing your baby's head coming through to crown like this and being like, wow, I'm so relaxed. This is so easy, right? And focus on number 3, affirmations. Give yourself a mantra, your pushing mantra. My vagina is so big. Wow, my vagina is so stretchy. I'm amazing. My body was made to do this. My body was made to do this. I can open so easily. I can open so easily. Give yourself a mantra. Build a relationship with that mantra by feeling pressure, relaxing to that pressure, and then using that mantra when you're pushing. The last thing you can do is really focus on building a relationship with the pelvic floor. So I feel pressure right here on this part, and I'm going to put all of my attention on allowing that spot where there's pressure to relax and unfurl. And then we do the other side, and I'm putting all my attention on allowing that pressure to relax. So it's kind of like the difference between experiencing penetration and being like, oh, like you're maybe gonna bump into my cervix, a little bit maybe that's a little too deep, kind of like the tension response when we're kind of like worried that something's not going to feel good, versus penetration that feels so good and you're like, wow, every time you thrust inside of me, I feel amazing. And I just want to respond to that by relaxing my pelvic floor and releasing completely. It's like this complete muscular surrender. So we want to access, it's the same thing. We want to feel the pressure and go, I completely give myself to this pressure. I'm completely relaxing into this pressure with no fear because I know that my body was made to do this. And we want to practice this. So moms aren't pushing a baby out and going like, my God, that is so much pressure. I can't do this. Get the baby out now. But okay, this is more intense than what I've been practicing, but I've been practicing this and I have tools and I've got this. So research has found that starting at 35 weeks is the time to start to reduce the risk for tearing for a first-time mom. But I think everyone should do it, and you can do it at any time that you feel ready and curious and you want to explore. I think 35 weeks is a really great time, and you can do it twice a week until you have your baby. Let's talk about a few other evidence-based tools to reduce tear risk. So the other one would be the warm compress. This is a really great tool. Sometimes doulas will apply warm compress. Other times doulas don't want to get all up in there, which is completely understandable. As a doula, there's always a possibility that you could get blood on you or human fluids. So having your own pairs of gloves or using gloves if you're at the hospital or birth center or wherever where they have gloves. If you're at home with the midwife, ask for some gloves if you're going to do anything like that. But often that's something that the midwife, provider, partner, or nurse can do. And so a warm compress is where we take warm water and we apply it to the perineum with a washcloth to support elasticity and flexibility in the tissue. And it's a great tool that can also reduce pain. So it can reduce the risk of experiencing a lot of burning and pain as the baby's coming out. If the mom is choosing provider hands off, we just want to be really mindful about how we're going to advocate in that moment. Because if the mom is choosing provider hands off and wants a warm compress and trusts the provider, maybe provider could be hands on, baby starts to emerge, we're going to go to hands off. But if we don't really trust that provider, if the provider said things like, I'm going to force you on your back, or I can't, be hands off, I have to be hands on, and dad can't catch the baby, that kind of stuff, and you don't feel very comfortable with that provider, maybe it would be better for the nurse to do the warm compress and for us to kind of reduce the likelihood of just giving the provider access if the mom doesn't want that access. So that is kind of like a happy medium sometimes that we can find with the warm compress. Yeah. The next one is provider hands off versus provider hands on. So provider hands on means that the baby comes to crown and the provider takes their hands and puts it usually on the perineum. When the head comes out, they might flex the head by pushing down, and then the head will turn. This is called restitution. So we go to crown, head comes out, head turns to the side, and it restitutes. And then after the head is to the side, the provider will usually pull down to try to get the top shoulder to deliver from underneath the pubic bone, and then pull up to try to get the bottom shoulder to deliver from the bottom part of the pelvis. So it kind of looks like some little down up motion to guide the baby out. This is completely okay if this is something that the mom wants. And a lot of the time it's not necessary. And research has found that it does not reduce the risk for tearing. It actually increases the risk for tearing, specifically a severe perineal tear, by giving someone an episiotomy. So like I said, the evidence-based episiotomy rate is 1, and in the US, it's much, much higher. The rate is much higher. So there are many episiotomies happening in the US and all around the world that aren't coming or aren't happening from an evidence-based reason, and which would be in the case of a true emergency, but because we think the baby's big or because you've been crowning for a little while or whatever, and that's just something we're used to doing. If the provider has indicated that they have a high episiotomy rate, or sometimes we just have to cut people and that's what we do. In that situation, it may be better to implement evidence-based ways to reduce the risk for episiotomy, like birthing on the side in a hands and knees position. And I would kind of counsel the mom around these options and what the research has to say, and evidence-based birth is a great resource. And then I would also counsel the mom on the option between provider hands-on, provider hands poised. Provider hands poised means provider hands off, which means they're just there and they're just going to witness the baby coming out, but they're not going to be immediately like doing things. If there are signs that the shoulders are getting stuck, which means like maybe the head comes out, but it comes out only to here and it's a really tight fit and it doesn't turn, or there's a cord around the neck or the heart rate is going down, like obviously that's a time where provider needs to step in. And providers can witness in any position and they can step in if needed, but they don't have to be routinely pulling on every single baby to support safety and protect the perineum. So that is also an option. Let's see. And the last one would be positions for pushing. So evidence-based birth says the best positions for reducing the risk for tearing are lying on the side, hands and knees, and standing. The positions that increase the likelihood for tearing the most are birthing on your back, squatting, and sitting. And that's because when we're squatting or we're sitting, we're putting a lot of pressure on the pelvic floor. When you stand up or in hands and knees, the pressure is more evenly distributed throughout the body, and that reduces the risk for tearing. But ultimately, every mom has the human right to birth in whatever position they want to. And it's important that we support moms in protecting them and pushing whatever position that they want to. And changing positions frequently is a really great thing to do too throughout pushing, especially if pushing has been a little longer, like an hour or more. I have a formula that I reserve for my coaching program on how to resolve that. And I just had a mom, her baby turned into OP during pushing. So her baby turned facing forward, entered leaning more towards OA, anterior, and then went through the pelvis and then decided to turn this way and try to come out this way, which is fine, but sometimes that makes pushing a little bit more challenging. And they said, you might have to get a C-section. The heart rate was kind of concerning. Maybe we have to do a C-section, and she did the formula, got the baby out, and had a really great vaginal birth, which is really cool. So I would say if a mom is in a squat position, or if the mom is sitting on the toilet and they're like, this is where I'm gonna be, that's okay. One thing you can talk to moms about before going into pushing is if they're saying, I really don't wanna tear, I'm so worried about tearing, you could say, okay, well, if you're in a squatting position, or if you end up on the toilet, because sometimes that happens, right? It happens to the best of us. We get stuck in the bathroom. How about I remind you to stand up if you're sitting on the toilet? Would it be helpful if baby starts to crown if I say do you wanna stand up? And encourage you to stand up, because that might protect the pelvic floor and your perineum as the baby's head is coming down. If you're squatting, I could say, are you open to maybe lying back on your side and letting the baby come out that way? Because those positions are better for the actual delivery of the baby. Sometimes moms are like, no, I'm just going to be where I want to be and I don't want any instruction, and that's totally okay. But you can ask them permission beforehand and kind of talk about what that might look like. But that's a really great suggestion to make if someone really wants to be in the best position and finds themselves squatting, and then they're like, I'm kind of stuck here, or I don't even remember that I have options. Pushing with an epidural, I recommend pushing side to side, hands and knees, and squatting. So I was talking about earlier, building relationships with your fears. So that means that the fears aren't taking over you. They aren't grabbing the steering wheel and driving the experience, but they're sitting right next to us. So I think what's really helpful as a doula is to just share a conversation with your client about fear. How are you feeling about birth? How are you feeling about pushing? How are you feeling about the actual delivery of the baby, about contractions? Are there any fears coming up that you want to talk about, that you want support with? And some moms are like, no, I feel really good. And then maybe they get close to having their baby and they're like, oh, but suddenly I do have fears. Other times, because that can happen sometimes. Other times moms say, oh my gosh, I'm terrified of everything, right? And sometimes it's just a couple things. So in my doula mentorship program and in my coaching program too, I teach my frameworks for working through fear. I track the outcomes of the first 100 moms I taught these frameworks to. So every single mom reported they weren't struggling with fear going into birth. So I really believe in these frameworks. I've really perfected them over the 15 years that I've been attending birth. And I'm going to teach you my favorite one that I created, which is called Witness, Validate, Love. So it's an approach to working with fear that is less around We're wanting to resist the fear and hope the fear goes away. It's not a hurdle that we have to jump over and conquer. Your fear is a part of you, and it is perfect. And as a doula, I really love to invite my moms to just like really hold this container of accepting and loving and embracing all that she is and all that they are, by offering an opportunity for them to talk about their fear and just validating them, seeing what it is that I'm seeing and validating them, and just holding love in my heart, being love while they're learning to love this part of themselves. And so you can also teach them, you can pass on this framework and say, there's a tool that I have that might be helpful. Is it okay if I teach it to you? Do you want to talk about that? And if they say yes, then you can go into it. What I would recommend is sharing it and kind of encouraging the mom to go through these 3-step process. So I would say, first, let's witness what's coming up in you. Oh, I'm seeing that you're having a lot of fear coming up about tearing. Is that what's going on? Kind of like have a conversation, just kind of witnessing it. We're seeing it, and kind of exploring like, well, where does it feel in your body? What kind of comes up for you when you think about it? We're just exploring it. We're seeing it. That's step 1. Step 2 is to validate it. Yeah, like I remember you said that your mother had got a really bad tear and had like pelvic floor health issues afterwards and kind of freaked you out about tearing. So, I mean, that makes so much sense that you're worried about tearing. Of course you're worried about tearing. Thanks so much for sharing that with me. So like we're just focusing on validating. You could also invite the mom to validate herself. So you can say, can you see how that fear is totally valid? And when we see that, we go, yeah, there's not something wrong with me. I'm not crazy. I'm not like, kind of suffering in this like dynamic with myself. It's like, it's okay that I have this fear. And then we're going to love ourselves. So it's really just about saying, I love you. I have this fear and I love you. And sometimes what I do is I invite a mom to say, or I invite her to see, I'll say, can you love yourself while having this fear? And sometimes they're like, no. And then I'm like, that's okay. I also have things come up for me sometimes. And I just like, I'm too difficult. I can't like love myself with this right now. It's just too hard. In which case, we're just going to love the person who's struggling to love herself. This is something also that moms can do on. Like you could say, how about next time you have this fear come up, let's work on building relationships with it by following the witness, validate, love tool. So you could go, I'm noticing that I'm having a fear coming up. It's okay to have this fear. I love you. That's what it is. And it's something that we can all just do during our day whenever fear comes up. And over time, we'll build some relationships with that fear. Another way that we can prepare really in the body is to do the perineal massage for emotional preparation. In addition to the witness, validate, love tool. I think those are 2 of some of my favorites that I teach that can really support moms. So giving moms tools is a really great way to doula so that moms can go into birth feeling a lot more confident and prepared and self-aware because they have some of those tools. The last one is advocacy. And so we're going to circle back to when I was speaking about doctor saying, get on your back, and like what we do to respond to that situation. So like I said before, the baby comes out most of the time in this 2 steps forward, 1 step back, 2 steps forward, 1 step back motion. That's how babies come through. It's rarely like the baby just enters the vaginal canal and goes, here I am, They kind of work their way there because we want to give the tissues an opportunity to stretch. And this is your body's own biological process protective to the perineum. And so I'm actually writing a book about this right now. Your body knows how to not tear, but we get in the way all the time when we bring in fear and tension. And when we bring in practices that are antithetical to protecting the perineum, that's like speed up this process. And so we're not able to keep it intact. So we want to protect the physiology and protect this normal process in a way that is in full alignment with the mom's preferences and how they want to deliver their baby. So advocacy is really great to do first before we even get into this space. We want to be prepared and reduce the amount of advocacy that's needed. And we do that by supporting the mom in creating a really clear birth plan that uses language that stands firm in her preferences and makes her preferences simple and clear. And then we want to go over that with the provider. I also recommend taking moms through a discovery process. And this is something in my doula mentorship program that I give the list of questions to my doulas, and I guide them with their clients to take to the provider and to go through and get the answers and bring it back and have a conversation about it. Because if we were to get a list of all these questions answered and we can see oh, there's big baby bias, oh, there's a high episiotomy rate, oh, they want you to birth on your back. We're going to make a customized plan on how we're going to navigate that. So we're not going in hoping for the best, but we're going in really well prepared and deliberate, recognizing like where the evidence practice gap is so that we can implement evidence-based strategies to reduce the risk there. So if like you are birthing in a facility that has a really great approach for like supporting intact perineum, they do intermittent monitoring, they support spontaneous pushing, but they have a high cesarean rate, maybe your risk for cesarean there is pretty high. So we should probably implement evidence-based ways to reduce your risk for cesarean with those people. And let's offer the mom some counseling around that and create a plan so that the mom can feel really confident and that you are also aware, right, of what those things are and how you can advocate in the moment. So we do that first. And then if we discover, oh my God, they have a really high episiotomy rate and he said he was going to force me on my back. First, let's change providers if we can. Sometimes we can't, not because it's too late, but because insurance coverage, access, right? It just depends on where you are and who you have access to. But if there are options, even if you're 38 weeks, you can still transfer care if you want to a lot of the time. And there are some hospitals that in the patient bill of rights allow you to get a new provider even in labor. So knowing that is important. And if we are in the situation where it's like, okay, this provider really does not feel like the best person and there really truly is no other option. We're in a maternity healthcare desert. This is the only place I can access. This is the only thing I can afford. If we're really in that situation, and maybe there's a rotation, maybe you don't get that person, but if we do, let's know beforehand what your rights are. If in the patient bill of rights you can get a new provider, let's know that beforehand so we can use that if we need. If you're at the hospital, you don't have to do this at a birth center or with a midwife, but at a hospital as a doula, I would take the birth plan, show it to the nurse, and interview the nurse by going through it and illustrating the things that are important. See how she wants to birth in whatever position she wants. See how she wants provider hands off. It would just mean so much to us if you could support us. The nurse is there to support in advocacy. Well, not always, but they can be. A nurse can be supportive. They can be on your side, not someone you have to advocate against. So the nurse is like your teammate and you want to be like in a good relationship with them. Engage that relationship with a lot of compassion and welcome and vulnerability and joy. And we want to make sure the nurse feels like a good fit. And if the nurse says, ugh, I don't really like supporting upright birth, we don't do that around here. Thanks for letting me know. Okay, cool. Bye, nurse. Then we're going to go to the nurse's station and we're going to ask for a new nurse and specifically say, this mom wants to birth whatever position she wants. And that nurse said she's not comfortable with that. Can we get a new nurse, please? Thank you. Well, let's cover just a few more advocacy tools for doulas. Another one would be provider walks in and they say, okay, mom, get on your back. Time to start pushing. And let's say mom is in hands and knees and she's like, I made it really clear beforehand. I don't want to push on my back. Maybe in that moment she can't talk. So she might just be like, and you already know as a doula that that's something that's really important to her. So in that moment, advocacy is really, really simple. It can sometimes feel really like overwhelming to our nervous system, being in the presence of an authority figure and trying to like stand firm. And when we approach it from fighting, it really can be so much more challenging than it has to be. It's really just about being calm and vulnerable and honest. Nope, this is important to her. She's staying in this position. The first tool is to decline again. So if a doctor comes in and says, time to get on your back, and you can say, oh, no, she's staying in hands and knees. The doctor might say, but she has to get on her back. In which case you could say, we said no. That's it. That's all you have to do. And then they might be like, blah, 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 blah. And you could be like, she said no. Thanks for taking care of us. We're declining. She's declining. Right? You're just like making it really simple and not getting into it. And then we're going to move on. Yeah. We said no. And that's the way it's going to be. We're not like, we said no and we're waiting for your permission and we're going to have a conversation about what evidence-based birth has to say. We're not changing anyone's minds in the moment. We're just going to be like, this is what we're doing. And we're not justifying our choices. We're just making it really simple. So the next tool would be to say anything that you see happening. So this is just to help bring to the space this thing is happening so that the doctor hopefully has a little bit more accountability and the mom is also aware of what's going on, because sometimes the mom is just not aware of what's going on. Sometimes doctors think it's okay, or midwives think it's okay to put their hands in someone's vagina when they're pushing because that's what we do, right? That's not okay. It's not okay to touch someone or put our hands in their vagina when they're pushing a baby out. And that might be the hardest time for a mom to advocate, because it can feel really like overwhelming and a lot is happening and people are rushing in the room. So what we can do as a doula is say, oh, I see you're going to do an exam. Sarah, are you okay with that? Did you consent to that? That's all we have to do. And often that kind of sparks like, I need to ask consent. It's not normal. It's not okay. It's not safe to do an exam or do something to someone without their consent. That's obstetric abuse. And so as a doula, we can witness anything we see and just say it out loud. I see you're doing this thing. Or you could also say, oh, she didn't consent to that. Wait, stop. She didn't consent to that. Sarah, do you consent to a cervical exam? Right? You can also say, oh, I see you're picking up scissors. Oh, I see you're picking up an instrument. What's that for? What are you doing with that? Act kind of like you don't know what's going on and you're just like, I'm just going to say everything that I see. That's really helpful. An advocate's role is to support informed consent being intact. Informed consent means that the mom understands the risks, benefits, and alternatives and knows that she can say no. That's important. And that's a part that's often not part of the conversation. So if someone says, we need to do a cervical exam, and the mom is like, clearly like makes a face like, I don't know if I want that, and the provider goes to do it, you could say, oh, wait, I don't think she consented to that yet. Hey, Sarah, do you consent to a cervical exam? And then she might be like, like, I don't want that, like just kind of make a face or shake her head no. Or she might be like, I don't know, whatever, I don't know, whatever is not yes. That is, I don't know, whatever. And that's not yes, that's not consent. So, in that situation, if mom isn't giving a clear yes, that's fine. If she's kind of like, I don't know, you can say no. It's okay to say no, because clearly that person wants to say no, but it might be feeling so overwhelmed in the moment or might have forgotten completely that she can say no. I remember being in one of my births and my midwife wanted to do something and I just was like, don't do that. But I couldn't say that. So I was just like, and then she said, you can decline. And I was like, I can decline? Yeah, I'm declining. I don't want to do that thing right now. I just forgot I could do that. If the typical doula route where you do a training and then you're left on your own to kind of figure it out is not really giving you all the support that you need, click the link below to book a free doula program call, and we'll talk about your work as a doula, your vision, what you want for your career, for your business, and explore if my mentorship program would be a good fit for you. My doula mentorship program is not just about teaching you stuff and then sending you out on your own. I'm here with you forever. I'm always going to be there for you as a mentor. I certify you in my peaceful birth method and all of the frameworks that are unique to me. I give you access to my private community of all the moms in my coaching program and multiple group coaching calls every week where you get to practice counseling, where you get to observe me supporting moms with these frameworks, and you also get to practice them before you're out on your own. And in addition, you'll have someone who's there for you as long as you need on your doula journey. So whenever something comes up with the client and you don't know what to do, you just reach out to me and I'll support you. If you are a mom and you're interested in my free birth course, just click the link below to join the Peaceful Birth Academy.